We're now going to introduce our honored guest, Dr. Barbara Ferrer, the leader of our LA County Department of Public Health. Our mission is to protect health, prevent disease, and promote equity and well-being among LA County's more than 10 million residents. Dr. Ferrer oversees a budget of over $1.3 billion and directs a multidisciplinary workforce of nearly 5,000 staff. Dr. Ferrer is a nationally known public health leader with over 30 years of professional experience as a philanthropic strategist, educational leader, researcher, community advocate, and public health director. Dr. Ferrer, thank you so much for joining us today. You are muted.
Great, sorry. Good morning, everyone. I'm really glad to be here with you today. And thank you, Dr. Baldwin, for your introduction. And also, more importantly, for leading the Public Health Office of Women's Health as the medical director. And I'm so grateful for the work that you and the entire team are doing to really increase awareness about domestic violence, intimate partner violence, make sure that our policies and our practices are aligned appropriately and support survivors. I also want to thank Blue Shield of California Foundation, the Leadership Council of Domestic Violence in Healthcare, Public Health's entire Office of Women's Health, our Domestic Violence Council, and of course, all of you and our many community partners who are doing important work every day to reduce violence and build peace. This is the second Beyond Silos Symposium, and I know the forum was providing a much needed opportunity for all of you to engage in critical conversations around increased engagement and innovative cross-sector collaborations between domestic violence work and our healthcare systems. So I was asked to come with a very particular role and, really was to provide some updates on the work with COVID-19 and knowing, in fact, how important the pandemic has been in creating both challenges and opportunities for all of us that require additional thoughtfulness in how we organize services and support. But again, we can go to the next slide. I do want to, just start by reviewing where we are in the pandemic, sharing some updated metrics with you. What's our progress in getting us to be to community immunity with many people vaccinated, how we're trying to build confidence in the vaccine so we can improve our vaccination coverage, and then just close with, sort of how challenging these times have been for everyone, but particularly for survivors experiencing intimate partner violence. And happy to take a few minutes of questions. I do have a hard stop, unfortunately, a little before 12. But again, grateful for the opportunity to be here today. Not sure why this slide is showing up with all blanks. But let me go ahead. No, the slide before. But yeah, I'm just not sure why the data is not on here. But let me just go ahead and show what were yesterday's numbers, because we're still getting today's reports in. We reported 29 additional deaths yesterday. That brings the total number of deaths, tragically, to over 26,000 in LA County. And that means we've met another grim milestone. And the milestone really is telling us that we've lost one in every 400 residents in this county to the virus. And we do share the sorrow of everyone who suffered the loss of their family and their friends. We also reported yesterday about 1,150 new cases, brings the total number of cases in LA County to 1,456,275. To date, nearly 8.5 million people have been tested and had test results reported in LA County. Our daily test positivity is at one of its lowest rates now. It's at 1.2%. This is a 21% decrease from last week's rate of 1.4%. Our daily average case rate is now about 11 cases per 100,000 people, and that also decreased from last week's case rate of about 13 cases per 100,000 people. There were 908 people that were hospitalized yesterday. Again, that's been a decrease of about 126 people over the prior week. So we can go to the next slide now. And also this slide, I don't know, this slide is also not showing the data. So I'm hoping, yeah, none of the data is on, at least on what I'm seeing. So I'm not sure we might have to sort of just talk through some of the data because it's not showing up on your slides. To assess the risk of COVID in LA County, we do use these CDC indicators and the thresholds to categorize community transmission of COVID-19. And while I just presented encouraging data showing a decline, transmission in LA County remains at the substantial level for the second week in a row, with our 7-day cumulative case rate is now about 76 new cases per 100,000 people. And this, again, a slight decrease from last week. But, if we were thinking back to the older days, back last year when we used the state's blueprint, we'd still be just transitioning from purple to red. So nothing to write home about, and nothing really to indicate that we don't have a lot of community transmission. We still have tons of community transmission, and the rate's very concerning. Let's go on to the next slide, see if we're going to do any better on the trend lines. Yeah, this slide has data. So this graph depicts the 20-month journey. It shows the trends in COVID cases, hospitalizations, and deaths in our county from the beginning of the pandemic last March through September 20th of this year. The peaks show what we experienced during our surges, but here particularly the winter surge, and now the much smaller surge that we're coming out of this summer, where we again had high rates of community transmission. We're really on our third surge. And as you can see, cases go up first, then hospitalizations, and then deaths, and then the same pattern on the decline. Cases will start to decline first, then hospitalizations will decline, and unfortunately, the last measure that declines are our deaths. And we still, while we're so glad that our numbers are going down, we're still experiencing about 15 deaths a day, and just about everybody who passes away from COVID is unvaccinated. So tragedy on top of tragedy. We can go on to the next slide. It is important to note that one of the reasons why our surge was not as great as it has been in the past, and even though we're really struggling with transmission from the most infectious variant we've ever seen, the Delta variant, is because we have a lot of people vaccinated. And I know there's concern because everyone at this point probably knows a vaccinated person that has ended up testing positive for COVID. I want to note how profoundly protective these vaccines are by looking at sort of the bigger picture. This slide shows the number of cases, hospitalizations, and deaths among fully vaccinated people. The large green box represents the more than 5.5 million residents. It's really almost 5.6 at this point, residents that are fully vaccinated. The tiny purple box in the left corner of this green box, and this is to scale, represents the 52,140 fully vaccinated people who tested positive as of September 21st. In all, less than 1%, that's really 0.9% of fully vaccinated people in LA County have tested positive. Of those who tested positive, 1,732 have been hospitalized, and this translates to 0.03% of all fully vaccinated people ending up hospitalized. 229 fully vaccinated people, and that's 0.004%, have tragically passed away. Most of the people who have died who are fully vaccinated have suffered from serious underlying health conditions and/or they were significantly immunocompromised. What these numbers show us clearly is that vaccines do not provide 100% protection from the infection, but they also show us that fully vaccinated people are extraordinarily protected from the most severe effects of the virus. The more residents we're able to provide with this protection, the safer our whole county ends up being. We go on to the next slide. So we do, oh, I'm really sorry about this. We really do, we can still show the slides, but just apologize that the data is not on them. We are remaining therefore laser focused on increasing vaccination rates as quickly as we can to avoid, oh good, there they are, to avoid the further surges of cases. Our numbers are rising slower than we would like, but as of September 23rd, 92% of LA County residents 65 and over have received at least one dose of the vaccine. 78% of residents 16 and over and 77% of residents 12 and over have also received one dose of the vaccine. And pretty much everybody who gets their first dose gets in and gets their second dose. 69% of residents 12 and over are fully vaccinated. So really just about at 70% now. But 30% of LA County residents who are eligible and not yet vaccinated is a lot of people not vaccinated. So we have a long ways to go. Out of the nearly 10.3 million LA County residents, including those who are not yet eligible for vaccine, they're under 12, 66% have received at least one dose, and 59% are fully vaccinated. Last Friday, September 24th, we did begin administering booster doses as well as the additional third doses that we've been administering to immunocompromised people. In total, we've administered 92,000 third doses. And over the weekend, when we first started doing our boosters, we have incomplete reports, but of about 15,000 booster doses given between Friday and Sunday. Next slide. There are a lot of questions that get asked about, who should get a booster, who may get a booster. So just to clarify, CDC opened booster eligibility to 4 groups of people, but the strength of their recommendation is not the same for all 4 groups. For 2 of the groups, the CDC actually recommends that they need to go in and get their boosters. And the other 2 groups, the CDC says they may receive boosters depending on an assessment that they do about the risks and the benefits. For all the groups, all 4 groups that are eligible, eligibility does start with you have to have received 2 doses of the Pfizer and just the Pfizer COVID vaccine, with the second dose having been received at least 6 months ago. And that means for the most part that you were fully vaccinated before April 1st. And most of those people who are fully vaccinated before April 1st actually fall into one of these categories. CDC's strongest recommendation is for older adults, 65 and over, and those adults 50 to 64 at high risk of severe COVID-19 because they have underlying medical conditions. This also includes people that are in these age groups that live in congregate healthcare facilities. And these folks should receive their booster shots because it's going to be important to build up their antibody protection. What the boosters do is they acknowledge that there's some waning protection over time from the vaccines, as there is with many other vaccines, and that for those at the highest risk of serious COVID illness, 6 months after you got your last dose of Pfizer, the data indicates you should come in and get that booster. But CDC also recommends that boosters should be considered by adults aged 18 to 64 that are in a job or an institutional setting that puts them at high risk for COVID-19. So this would include healthcare workers, teachers, daycare staff, grocery workers, other essential workers, adults who live in communities that have been disproportionately hit by COVID-19 and have more transmission are also in this group, along with people working or living in shelters and prisons. CDC also recommends that adults 18 to 49 with underlying medical conditions that put them at risk for severe COVID-19 illness should consider getting their booster shot as well, oftentimes consulting with their doctor if they have questions. These people are eligible to receive their boosters because work, school, or their underlying health condition or their age create risk. And for those that are in job or institutional settings, occupational settings that are putting them at higher risk, that is because the work workplace, the school, or another activity is leading them to engage with many other people. And, as we know, particularly when you have higher rates of community transmission, it's that intermingling that allows for there to be lots more exposures. So please, take a look. We have lots of information on our website. We can go to the next slide. We do get some common questions, so I do want to take this opportunity to just answer them. One of the most common questions is from people who have received the Moderna or the Johnson & Johnson vaccines, and they're not in the group of immunocompromised people who are qualifying for a third dose of Moderna. And many people in these groups are anxious to know what they should be doing about getting booster shots, especially if they are in one of those groups that CDC has said is at higher risk. But for now, those people should not go and get a Pfizer booster dose or a third shot of Moderna or a second dose of J&J just yet, because the CDC and the FDA are still reviewing data for those vaccines on their safety and effectiveness of using them for boosters and on the safety and effectiveness of mixing vaccines. So we would ask if you are a person who was vaccinated with Moderna or Johnson & Johnson, that you allow the FDA and the CDC to complete their reviews. They should be issuing recommendations on boosters for these vaccines within the next few weeks. And just to note, you don't need an appointment to go to get your first, second, or third dose at most places in the county, but you can make an appointment if you want, and you can go to myturn.ca.gov or do vaccinatelacounty.com to make that appointment. If you go to vaccinatelacounty.com, you'll also get a ton of information on our walk-in sites. It's particularly important to note that while we have 1,300 places that administer vaccines in the county and 400 mobile teams that are out and about in communities administering vaccine, you need to go to a place that's administering Pfizer vaccine, and that's a slightly smaller number. So make sure you check that, in fact, where you're going, if you're going for a booster, is one of the sites that administers the Pfizer vaccine. We can stay on that site for just a second. All you're going to need to bring with you for your appointment is proof of your 2 previous Pfizer doses. So that's your white vaccination card, a photo of your vaccination card, a medical record that documents you received these vaccines, or your digital vaccine record. And just to note, you can get that first, second, or third COVID vaccine at the same time you receive other vaccines, including your flu vaccine. So the best thing to do is not to delay getting either flu or COVID right now, and they can both be administered at the same time. We suggest doing them in separate arms at places that administer both of those. This slide that we have in front of us is a super important slide for all of us, because while we've made strides, you saw our overall numbers. You can share the concern that we have when you look at this slide to see the gaps that we continue to see week after week, particularly among Black and Brown communities where they have higher proportions of young unvaccinated people. All of the ones that are highlighted in red are places where we haven't really reached a 60% of folks in that population subgroup being vaccinated. And when these numbers remain low, it's because we're simply not getting enough new people in for the first dose of vaccine fast enough. When that low uptake is concentrated among racial groups or age groups who are also at higher risk for exposure, this unfortunately translates to great risk that future waves of infection will again disproportionately affect our Black and Brown communities and our essential workers. Given the tremendous efforts that have been made by our vaccination partners and community health workers to provide accurate information, to answer questions, and to take vaccines directly where folks live and work, we do need to acknowledge that time's no longer on our side. We've been here before. During early fall of 2020, community transmission was very low. Until then, it wasn't. Last winter was brutal. And given the unpredictability of the virus and the variants, we do need to accelerate the pace of vaccinations since this is our most effective tool to prevent another deadly surge. So for those people who are unvaccinated, who may be in our audience, or for those of your friends who are unvaccinated, we're asking that everyone reassess that decision and factor in the fact that we've already lost 26,000 people in LA County to COVID. Next slide. But we do take seriously our obligation to build confidence in these vaccines. And that also is the work that we're laser focused on now to increase those vaccination rates. So we have a multi-pronged approach. We've obviously, as many of you know, we have lots of town halls, big ones, small ones, where we really try to answer people's questions and bust myths that we know are circulating and that need to be addressed. We've also got a vast coalition of more than 340 faith-based organizations that both provide information, they tap into strong community networks and their relationships to reach people with good information, and they also sponsor mobile clinics. We've actually also awarded about $67 million to dozens of our community and faith-based organization partners so that they can be supported in the efforts that they're doing to provide accurate information about the vaccines, recognizing that they are the trusted leaders. Many of these organizations have mobilized hundreds of promotoras and community health workers that are engaging with residents. They go door to door. They're at our parks. They visit businesses. They go to community events, and they listen to the concerns that residents have and try to connect them with appropriate resources in multiple languages and always in a culturally respectful manner. We also have our community ambassador program, and this empowers community members to come in for a training virtual so that they can have accurate information and they can be a source of trusted information for their friends and neighbors on how we can all work together to reduce the spread of COVID. Next slide. And obviously, so you can build confidence, but you have to also make it as easy as possible for everyone to get vaccinated. So we have lots of different strategies. And again, this vast network that helps us. We have community sites. We have pharmacies, health plans, federally qualified health clinics. We have about 400 mobile teams that are out every week that go to work sites, special events. They vaccinate homebound individuals. Anybody can request a mobile team to come to a community event, a work site, or a faith-based organization, a house of worship. We have vaccine events taking place at parks, metro stations, grocery stores, sporting events, anywhere we find where people are congregating. We provide free transportation to folks. We allow for walk-ins. You don't need an appointment. We never ask questions about immigration status, and no government ID is needed to get a vaccination. So we're going to continue working to make sure that vaccines are easily accessed by anyone who needs to get a vaccine. But I do want to acknowledge that, when you're living through a pandemic, for some residents, not only have they faced all of the challenges we all have faced, they have additional challenges. And for some of our residents, they've been struggling with substance use disorders, with chronic health conditions, and obviously those that are living with intimate partner violence. And that's exacerbated by this pandemic. So I did want to end my presentation with just a few words about intimate partner violence, and particularly how reporting intimate partner violence has become especially challenging during the pandemic. And I want to highlight this just because, let's not wait for the next pandemic before we fix some of these systems issues. There are lots of barriers already to reporting intimate partner violence, fear to report, the stigma. But unfortunately, our systems during the pandemic made this even more difficult. We have deficiencies in linguistic and cultural competency among the provider communities, and we had provider communities that actually weren't open during the height of the pandemic, again, making it hard to reach people in need of services. when we shift our services to a virtual environment, there's a digital divide that for some folks is insurmountable and makes it really difficult then for folks to seek guidance that they need. There's also obviously inadequate accommodations with virtual platforms for people with some sets of disabilities, and that not yet either. So, I'm just laying these out as these are the challenges. And then, staying laser focused on the challenges people were already having, and then some people ended up having around maintaining stable housing, food security, and financial wellness. So these concerns are all of our concerns, and building out a system that now, after living through 20 months of a long-lasting, deadly pandemic, should require us to stay super focused on what system fixes are needed and to start making those system fixes now. Individuals, families, communities, the whole world, we've experienced increased stressors. We've lost lives and livelihoods from COVID-19. And there have been uncertainties around acquiring basic needs, and many of us have been cut off from our support systems, including our friends, coworkers, family members, and loved ones. These challenges are striking for people who are surviving intimate partner violence. And we have to figure out how we're going to support survivors during the pandemic. And the pandemic's not over. So we've got to work together. We need to elevate the voices of the survivors to guide us on how to support the development and implementation of survivor-centered, trauma-informed programs and policies that survive the challenges of living through a pandemic. So, from where I'm sitting, improving coordination and partnerships, reducing silos, making our systems easier to navigate, building stronger partnerships between domestic violence agencies and healthcare systems so that there's continuity of care, and where some people may not be able to continue with services as others, you have backup so that no one ever goes without getting what they're needed. And we should champion, more intentionally the no wrong door approach. Wherever people are able to seek services and get services, domestic violence can and will be addressed. So we're a proud partner of this event today. We're anxious to be a good partner to help foster opportunities for us to do our work together, and to, again, make sure we're focused on both the equity issues and the emergency imperative in front of us at the moment. So want to thank everyone. And I know I have just a few minutes to answer some of your questions.
Thank you so much, Dr. Ferrer. It's very sobering to see those numbers and really recap what's been happening with IPV survivors. There are a lot of questions. I note that some of them in the chat I can answer as soon as I'm off this part of the platform that are more straightforward. And given that we have 1 minute, Dr. Ferrer, we know that our domestic violence service providers pivoted and did a wonderful job of meeting survivor needs in Los Angeles County during the pandemic to the best of their ability. Which, for someone who's currently experiencing IPV and does want to leave their home to try to be away from their abuser, we know not everybody wants to leave. Many people want to work out their relationship. But for those seeking emergency shelter or housing, what can you tell them about COVID-19 safety protocols that are in place to protect them from becoming infected in group settings?
Yeah, it's a great question, and it's super important, around sort of our fear of exposures, particularly in congregate settings. So first, I want to thank all the shelters. We've issued a lot of guidance, and there's super high compliance. So it is safe to be at a shelter, and it's certainly safer to be in a safe place than to be in a violent home. So I want to just encourage people to understand that you can be at a shelter, and the shelters can be run with a lot of safety measures in place. And most of our shelters have, in fact, that are open, have in fact done an amazing job, an outstanding job at putting in place protections. So those protections include a lot of distancing measures so that people aren't crowded. creating as much as possible ways for people to be outdoors for many of their usual activities. So, wherever possible, eating outdoors has always been safer. Everyone has to wear a mask indoors in all of the common spaces, and people are really getting good at that. And when there is a case, that person needs to be quickly isolated and all their close contacts need to be quarantined. And we help with that. So we have our own staff that help at all of the shelters, making sure that we also have facilities where people can go to do that. So that, again, if the shelter can't accommodate isolation and quarantine, we have other facilities at hotels where people can be isolated and quarantined, again, with a lot of safety. But there's, obviously a lot of ways to do this with a lot of safety, paying attention to infection control, distancing, and masking. I would be remiss to not do a huge push for vaccinations. So you don't need to be vaccinated to seek out support at a shelter. But once you get settled at the shelter, if you're not yet vaccinated and you're in an eligible population, you're 12 and older, please get vaccinated. You create safety for yourself and you create safety for everyone around you. So it's hard sometimes to focus on taking care of yourself and taking care of your health needs. But once you are settled at a shelter, if you haven't had an opportunity to get vaccinated, all of the shelters are offering easy ways for people to get vaccinated. And again, here's where our mobile teams can come in and be super helpful. But thank you all for all you're doing. Appreciate all your support, and so glad that you all were able to get together today. I know how important it is to really connect with each other and support each other. And we have months to go, but we're going to get there because we're going to do this work together. So thanks a lot, everyone.
Thank you so much for joining us, Dr.